Cholera in Sudan. The article that caught our attention was published by The Guardian on August 14, 2025, titled Sudan Cholera Outbreak Kills 40 in a Week as Healthcare Centers Overwhelmed. It reports on Sudan's worst cholera outbreak in years, which has already killed at least 40 people in 1 week and caused over 99,700 suspected cases and 2,470 related deaths. The article highlights how the country's 2 year civil war has made the outbreak much worse by destroying healthcare systems, displacing families, and leaving communities with no access to clean water or sanitation. The MSF quotes the situation as beyond urgent, with hospitals and treatment centers overwhelmed by the number of patients, to the point of many people being treated on mattresses on the floor and families forced to drink contaminated water from wells where bodies even have been found. The article also explains the impact that the weather has had, with heavy rains and flooded sewage systems worsening the spread of cholera. MSF and the World Health Organization are calling for an international response to provide clean water, sanitation, and vaccination campaigns to prevent more deaths. What is cholera? Cholera is an acute, severe, and sometimes lethal diarrheal illness. It is caused by the bacteria Vibrio cholerae, a gram-negative curved bacteria of the small intestine. It is spread through the drinking of contaminated water and the consumption of contaminated food. Within a short period of contracting cholera, severe dehydration can occur, and as a result, cholera is associated with a very high mortality rate. Once in the body, it multiplies in the small intestine and produces a toxin that causes the body to expel large amounts of water, leading to profuse, watery diarrhea. Without the prompt medical treatment, cholera can result in severe electrolyte imbalance and death within hours. The importance of the topic to nurses and other healthcare professionals. Overwhelmed healthcare systems. Health centers in Sudan are overcrowded, forcing staff to treat patients on mattresses on the floor due to limited beds and resources, and through that, nurses are directly involved in managing high patient loads under extreme pressure. Infection control and challenges. The shortage of clean water makes it nearly impossible to follow essential hygiene measures, such as hand washing, washing dishes, and clean food, which are all crucial for preventing cholera spread and other microorganisms. Unsafe water and sanitation conditions. Displaced families are forced to drink contaminated water, even from the wells where bodies were found, showing the urgent need for safe water access and public health education. Role in global health advocacy. The article calls for an international response to improve healthcare, sanitation, and cholera vaccination. Nurses play a vital role in advocating for global aid and raising awareness of preventable diseases in crisis zones.
So the article it chose is titled Cholera in Sudan Amid War and the Health System Collapsed by Alex Bush. Sudan is facing a severe cholera outbreak made worse by war, flooding, and a collapsing health system. I found this article important because it showcases us how nurses play a key role in prevention, health education, and patient care during public health emergencies. Since August 2024, there have been over 15,000 cases and more than 500 deaths. The conflict had destroyed hospitals, water treatment plants, and sanitation systems. About 70% of hospitals are no longer functioning. Refugees and displaced people are the most affected, facing poor living conditions and limited access to clean water. Experts stress that the urgent need for international aid, vaccine campaigns, and public health education. Health workers are providing home-based care and training community members to manage dehydration. The article concludes that without peace, funding, and a better sanitation system, Sudan cholera crisis will continue to worsen.
The article I chose is Cholera and Conflict, Outbreak Analysis and Response Lessons from Gadarav State, Sudan by Ahmad Izzuddin, because it basically creates a timeline of cholera outbreaks in Sudan and evaluates the relationship between cholera and Sudan as a state. Over the past 10 years, cholera outbreaks have been common in Sudan. For example, in 2016, a cholera outbreak affecting different regions of Sudan resulted in 15,000 cases, out of which 279 people died. In 2019, another cholera outbreak declared in Sudan caused a case fatality ratio of 2.3% in Sennar and 4% in Blue Nile. In response to this outbreak, the oral cholera vaccine was introduced and administered and was deemed effective. In April 2023, the conflict in Sudan led to 10 million people being displaced. Due to this displacement, living conditions such as shelter, water quality, and sanitation deteriorated. This promoted the spread of infectious diseases, and soon enough, a cholera outbreak was reported in Gadaref, Sudan in late August 2023, just 4 months after the conflict started.
Now let's talk about the cultural considerations of cholera in Sudan. Cholera outbreaks in Sudan are made far worse by poverty, conflict, and displacement. Many families live in rural or camp settings with very limited access to clean water, sanitation, and healthcare. Because of this, they're often forced to drink from contaminated rivers or wells. According to the article The Guardian, families in displacement and refugee camps often had no choice but to drink dirty water, the main cause of cholera. This shows how the ongoing civil war and lack of infrastructure push people to use unsafe water just to survive. Another important factor is community trust. In many areas, people rely more on local leaders, elders, and religious figures than on government officials or international aid workers. This cultural trust shapes how people receive health messages and respond to outbreaks. When these trusted leaders share information about safe water and hygiene, the community is more likely to listen and act. Women are also deeply affected by this because they are often responsible for collecting water, preparing food, and caring for sick relatives, which increases their exposure to contaminated water and infection. Sudan is considered marginalized, particularly rural communities, displaced people, and refugees. They lack access to clean water, medical care, and vaccines, making them vulnerable to disease. According to the article The Lancet Infectious Disease, about 70 to 80% of healthcare facilities are non-functional, leaving two-thirds of the population without access to care. While the privileged are considered wealthier, individuals in stable areas have better access to essentials. Globally, Western and donor countries hold privilege with control over humanitarian funding and media attention, but international support for Sudan remains limited, leaving millions without aid. To effectively manage cholera, multiple groups need to be included. First, local community leaders, including tribal elders, religious figures, should be involved because they are trusted voices who can guide people towards safe water and hygiene practices. Second, women and displaced population must be part of the decision-making process since they are effective most and understand community needs best. Third, local NGOs and Sudanese healthcare workers should lead culturally appropriate interventions and education campaigns. Finally, international organizations like World Health Organization, UNICEF, and Médecins Sans Frontières should continue to provide vaccines, clean water, and medical care while working closely with Sudan's Ministry of Health and neighboring countries like Ethiopia and Chad to strengthen cross-border surveillance.
Nursing implications. So nurses play a central role in preventing and managing cholera outbreaks, particularly in conflict-affected and resource-limited regions like Sudan. They educate communities on hygiene practices such as proper hand washing, safe food handling, and using clean water to reduce disease transmission. Nurses also teach families to recognize early cholera symptoms and prepare oral rehydration solutions to prevent severe dehydration. In displacement camps and remote areas, nurses can lead home-based care initiatives and train community health workers to identify and treat mild cases promptly. They also support vaccine campaigns, ensuring that vulnerable groups, including children and refugees, receive protection. By collaborating with public health humanitarian organizations, nurses can advocate for a better sanitation and access to clean water. In addition, they contribute to disease surveillance and data collection to guide response efforts. Providing emotional support to affected families can reduce stigma and help build trust and strengthen the community resilience. Ultimately, nurses act as caregivers, educators, and advocates, promoting health equity and stability during crises.
From a phenomenological approach, we know it focuses on understanding the lived experiences of patients or clients. An example of this would be when patients had no choice but to drink water from a well a dead body was discovered in. We as nurses try and understand how this experience shaped the client's sense of safety, their feelings, sense of vulnerability to their conditioning worsening, and even if it altered their hope of surviving. Following this is the critical social theory, which reviews injustices in unequal power and underlying social relationships which are often concealed. This cholera outbreak isn't simply biological or spontaneous.
It reflects social and political injustices as well as iniquities in Sudan. The country's war, disrupted economy, disrupted infrastructure, and poverty are all factors of economic and political oppression which are limiting the people of Sudan from accessing proper sanitation and healthcare resources. Like the article said, the country's 2-year civil war aids the spread of the disease. Lastly, the social justice approach, which encourages us as nurses not only to provide care, but also challenge injustices in society and advocate for equity. An example of this in the article is when Sudan's MFS head of mission, Tuna Turkman, called for international help by stating, to provide health care, improve water and sanitation services, and begin cholera vaccine campaigns in affected areas at a pace that matches the urgency this catastrophic situation requires. She also states, survivors of war must not be left to die from a preventable disease. With these two statements, Turkman advocates for equitable access to basic healthcare services so vulnerable people in Sudan receive the proper care and resources they need.